Genetic testing of embryos, and what does that mean for your follow-up OB care? This is a topic of conversation that myself was completely misinformed when I was pregnant with Dante, who was a genetically tested normal embryo. So let's start at the top, Serena. What are we really testing when we're genetically testing embryos?
So first of all, we do most of our genetic testing on embryos from people who don't have any genetic disorders. That's first of all, because we're usually testing for chromosomes, and everybody makes some chromosomes that have some embryos that have extra missing chromosomes. So this is called PGT-A, pre-implantation genetic testing aneuploidy, and that's like the most commonly performed kind because it is so common to have chromosomally abnormal embryos. Now, 1 out of every 4 pregnancies ends in a miscarriage, and most of the time it's due to an extra missing chromosome. And so it's just something that happens in Mother Nature. When you have infertility or as you get older, it becomes more common, and that's why so many of our patients can benefit from the PGT aneuploidy, or testing their embryos, even if they themselves are perfectly genetically normal.
Got it.
But it is confusing because even your doctor will be confused. So I have so many patients that went through just what you went through. They go through infertility, they do IVF, they do genetic testing on their embryos, they get a genetically normal embryo, they become pregnant, happy, heartbeat, bye, see you later. And then they go see the OB, and then the OB is like, well, these are all the things we normally do for people that are pregnant, but we're going to skip them with you because you did that PGT thing. And that's potentially dangerous because we could easily miss things because PGT, or testing of your embryo, pre-implantation genetic testing of your embryo, is not the same as testing the pregnancy. And all pregnant women deserve to have the normal full testing that your OB would normally do for you, given your age and your other circumstances, whether or not you had genetic testing on your embryos. Because genetic testing an embryo, it's tiny, it's pretty accurate, but it's not nearly as accurate as testing a pregnancy. And developing from an embryo to becoming a baby, all kinds of things happen, including sometimes genetic changes. So we that's
the biggest area of misinformation of what you just said, which is the process of going from an embryo to a baby involves a lot of cellular division, and genetic changes can still happen. So you want to start with the healthiest embryo possible, and that's why you do PGT-A in the first place, to make sure that you're picking a normal. Right?
Yeah, because it definitely lowers the chance that the pregnancy is going to have an issue. It's not 100%. So, when I tell this to people, some people are like, well, why do I do the PGT at all? What's the point? Because it does make a difference. It does lower your risk for, the normal miscarriage rate is 1 in 4. Most of our infertility patients have a 1 in 2 miscarriage rate because of their age or their history. And PGT gets you down to 1 in 10 miscarriage rate or
wow, that's significantly different. Okay.
Huge difference.
That's a big deal. And the reason I chose PGT wasn't just because, of working in this field, but I had already experienced multiple chemical pregnancies. And so I wanted to make absolute, with certainty. I also couldn't make any new embryos. We really didn't feel like I had, egg supply after chemo to make new embryos to keep trying with that. So I had to go to my frozen embryos. I did the PGT-A on them to make sure. And of course I have a healthy child. So I was very confused. And I remember getting into an argument with it wasn't my OB. It was actually somebody who was standing in for her because she was on maternity leave for part of my pregnancy. And I remember being so upset because I was like, no, I already know that he doesn't have Down syndrome. I already know. And that was kind of a big issue, is because I knew that the PGT-A covered that. And they were saying, no, that was just the embryo, not the baby. And in the end, it did kind of, it was a battle. I have to admit, it was a battle because I was so confused.
Okay, so at the same time, that just like any other pregnant woman would hear all the information, weigh the pros and the cons, and then decide whether or not to do testing, you would still do that. It's just that PGT is not an automatic no prenatal testing.
Right. It's not
it just puts you in the same box as everybody else. Don't use the PGT to make your decision. Fully, just weigh your decision. So like the non-invasive testing, I think that's a no-brainer, right? You get sonogram, you get blood work, no big deal. It's no harm, no foul. You just, there's no harm to doing that testing. But an amniocentesis or a CVS is a little bit different because those have about a 1 in 200 or 1 in 300 rate of losing a normal pregnancy. So it's a low risk, but it's still obviously much riskier than just doing a blood test. So, you know, and a lot of people that do PGT have had recurrent miscarriage, and they would rather take a tiny, tiny risk that the PGT is not correct rather than taking that risk of losing a healthy pregnancy.
Absolutely. Yeah.
This is the issue, is like there's never anything that's totally risk-free, right? So it's all about like understand the risks and the benefits and don't make that assumption. And honestly, most OBGYNs don't know a lot about what's going on in our field because we're barely keeping up. It's changing so rapidly. So just, you know, just ask your IVF doctor, hey, you know, like if you have a question, just ask. But it doesn't.
When does that testing usually happen too? So you are with your patients till week 9 of the pregnancy, right?
8.5.
And then when we graduate, I remember graduation day. I didn't want to go because we get so attached to you guys. I did not want to leave.
No.
And also we get so much more, you know, you're getting a lot more blood work, a lot more scans. Yeah. But then when you graduate, at what point does then the prenatal screening happen?
You know, this is Alice. I don't even do it that often. I think it's like around 9, 10, 11 weeks, but I I don't know the exact range because I don't do it every day. I should know this, but
you haven't done an OB rotation in a while. So, you know, we had a patient actually email me over the weekend and say, you know, I finally got pregnant and I'm so worried about losing the pregnancy. I can't get into my doctor. And I encourage, hey, you can still do a telemedicine visit. Let them, you know, at least to like assuage your fears and so forth. But we're talking about routine scans and blood work. You know, that, like you said, it's non-invasive. This is something more data to help keep people calm is better too. So, you know, I feel like the infertility community, go into pregnancies with so much anxiety, you know, that it's even hard to be celebratory until you actually have your crying newborn in your.
Oh my gosh, that's a whole nother topic, Alice. We should talk about that. That, like, you know, once you're pregnant, it's not the end of all that anxiety. We do, you know, it's hard. It's hard.
Yeah. But I do feel like this what we're advocating for with people weighing both the risks and the benefits of then another level of screening is that in a lot of cases, it can actually, in most cases, because you have done the PGT, in most cases, they're not going to find anything new. That would really be unusual, but sometimes it does make a difference. And, you know, we don't want you to miss out on that testing because you deserve to have the same care. You know, like it's just that the obstetricians are not trained in this area. Exactly. I wasn't trained in this area when, you know, because when I did my fellowship, it's changing so rapidly. I'm in the field. So of course I know all this stuff, but so I think that's really typical that most OBGYNs, unless they're very savvy with the IVF, very typically we don't expect them to know that stuff. So you just have to be aware. And we try to tell all our patients, and if you look at the PGT reports that you get, your records, it will say this is not the same as prenatal testing. Right. But it's confusing. It is. Sure, it is. It is because you're like, but I put in because you expect that if you put in the normal embryo, it's going to stay normal. And I think that is like the fear and the concern. Of course, this is why you got to take your prenatal vitamins, got to take that folic acid because
there's all that epigenetic stuff. Like that's why that's why you can't drink alcohol. So you have a perfect embryo, but you drink alcohol. there's going to be an epigenetic effect on the baby's, brain and things, and Zika virus. Those are all like epigenetic type things.
Yes, really good point. About the Zika, really good point. So that what we're advocating for is that you've already gone the extra mile to genetically test the embryo. Now consider testing the pregnancy as well.
So doing your prenatal testing, not necessarily invasive though. Not a lot of most prenatal testing these days is just non-invasive. Sonogram, blood work, that's it.
Exactly.
Yeah.
Okay, perfect. And if you have any outstanding questions about it, Fertility Answers app, definitely hop on, ask your questions. Serena's available, as are 320 of her colleagues and closest friends on the Fertility Answers app. But we're here for you. We know this is a tricky time, and if you're feeling anxious about the pregnancy, you can't get in for that sonogram visit. And your blood work, if your blood work is delayed, just pick up the phone and have a telemedicine with your doctor.
Let them call your doctor. A lot of it is just about information. Just making sure you have the right information, because and if you really need the blood work or the sonogram, your doctor will be able to figure that out.
Exactly.
You got to talk. You got to talk to your doctor.
And that's your Monday motivation today. Self-advocacy, that's where it's at. Thank you so much, Serena. We'll see you next week on Monday Motivation. Bye, everybody.
Bye.